So let's talk about your role in caring for residents' hygiene grooming. So the relationship to grooming and personal care as it relates to self-esteem, you are members of the health team are responsible for providing personal care grooming for your residents. Encourage them to do as much as they can for them, but if they're unable, assist them with their personal cleanliness, hygiene, nail care, shaving, dressing, care of their hair. Personal grooming is important for image, and every effort should be made to encourage and assist the resident to an attractive appearance. So some of daily hygiene needs: bathing, hair, oral hygiene, shaving, shampooing hair, nail care, hair care, perineal care, and dressing and undressing. Some of the things that affect our hygiene practices could be our culture, what our family actually does, their practices, whether we're sick or not, and individual preferences. Some people prefer to bathe in the morning, and some people prefer to bathe before they go to bed. Some of those other preferences are: how often do we bathe or shave, and do we shampoo our hair daily, every other day, or weekly? Some of the factors that can affect those practices are economic. Some people actually cannot afford deodorant and shampoo. So it comes down to a choice of their utilities, food, or things such as luxuries, deodorant, and shampoo. Some people also can't afford the utilities, so they have no water to wash their hair. So the role of the nursing assistant is to assist the resident to follow their personal hygiene practices, encourage them to do as much of their daily care as possible, and assist them in selecting their own clothing. Promote independence and self-esteem, and encourage the use of deodorant, minimal perfume, aftershave, lotion, and cosmetics. Be patient and encouraging with our residents. So let's talk about oral hygiene. So oral hygiene measures used to keep the mouth and teeth clean and free from microorganisms. We're going to prevent odors, infections, tooth decay, and loss of teeth, prevent gum disease, increase comfort, and enhance the taste of our food. So oral hygiene is provided before breakfast, after meals, at bedtime, and at other times as requested. It's provided frequently for residents receiving oxygen to prevent the mucous membranes from drying out and to promote comfort. Things you need to report are foul mouth odors, bleeding, loose or broken teeth or dentures, sores in or around the mouth, a tongue that is coated, complaints of pain. So when you brush someone's teeth, hold the brush at 45-degree angle, use circular motion when you brush teeth. The brush well where the teeth and the gums meet to maintain less gingivitis in the mouth, which means plaque around that area. Brush all surfaces and the tongue. Brush the upper teeth first. Brush gently, and you can also offer diluted mouthwash to rinse the mouth out. Do not let your resident swallow the mouthwash. Denture care. So handle dentures carefully. They are very expensive. Clean as often as natural teeth. Protect from loss or breakage. Store them safely when out of the mouth in a labeled container. The label should have the resident's name and their room number. Never use hot water, which can warp dentures. Store them in a dry container, or a container with water, or in a special solution. For long-term storage, for instance, if your resident was in the hospital, put the container holding the dentures in the bedside stand. How do we take them out? Make sure your resident is sitting upright, preferably at a 90-degree angle. Put on your gloves. Remove the lower denture first, it's easier. Grasp the lower denture with gauze for a good grip because they can be slippery. Give a slight downward pull to break suction. Turn at an angle to get them out of the mouth. When we put the dentures in, again, make sure the resident is sitting upright. Put on your gloves. If denture adhesive is needed, apply it at this point. Place the upper denture into the mouth by turning it at an angle. Straighten the denture and press onto the upper gum line firmly and evenly. Lower the denture and press firmly. So how do we take care of mouth care for someone who is unconscious? Unconscious residents may be able to hear you. Hearing is the last sensory function that a resident will lose. Talk to them as if they were alert. Some special mouth care products are swabs, toothettes, which are usually soaked in mouthwash or plain water, hydrogen peroxide, saltwater solution, whichever is specified on the care plan. Petroleum jelly or olive oil can be placed on dry lips. Now let's move on to nail care. So the purpose of nail care is to prevent infection, prevent injury, and prevent odors. Nails require daily cleaning and trimming, and toenails as often as needed. Maintain the nails by keeping them short, clean, and free of rough edges, which can scratch. Easier to trim and clean nails after they're soaked. Nail clippers can be used to cut and trim nails. Use care not to injure the skin when clipping a nail, and you need to be very, very cautious if you're clipping the nails of a diabetic patient. That should typically be done by a nurse or when you're ordered, and the nurse should be very aware. Clip the nails straight across. So use a file or an emery board to smooth the rough edges. Softened cuticles can be pushed back with the orange stick. Diabetics and residents with circulatory problems will have their nails trimmed by a licensed nurse or a podiatrist. Review the resident care plan and check with your supervisor prior to trimming nails. Let's move on to foot care. So we wash patients' feet, residents' feet, with soap and warm water. Dry the feet carefully, especially between the toes. That allows for things to grow. Apply lotion to tops and bottoms of feet only and not in between the toes. Watch for redness, warmth or constant pain, numbness or tingling, dry cracked skin, swelling, blisters, cuts, scratches, or other sores, ingrown toenails, corns, and calluses. Do not use a heating pad on the resident's feet. Keep footwear on and never let them go barefoot. Change their socks and shoes daily. Foot injuries and infections can lead to gangrene and amputation, especially in a diabetic resident. Notify the supervisor immediately of any unusual observations of the feet. Shaving. How do we shave? So it's important to keep a man's face shaved. Shaving is a necessary personal care even if he's sick, unless he wears a beard. Keeping the whiskers off his face may make comfortable. How often should a man's face be shaved? If there's no skin problems such as cuts or sores, they can be shaved daily. How do you shave a man's face using a safety razor? And you guys can actually read. Place the following items within reach: gloves, sharp, clean razor, shaving cream or soap and a brush, towel and washcloths, basin filled with warm water, aftershave lotion, and talcum powder if they want. Usually don't use talcum powder because that can cause problems with the respiratory system, and a mirror. So you guys can actually continue reading. Most of us will actually use an electric shaver for our residents' faces, and this is how we actually do that. So the biggest thing here is as we shave to use circular motions and shave each area until it looks and feels clean or smooth. If the patient's alert or the resident's alert, ask them. So some safety tips. Make sure the cord of an electric shaver is in good condition, yet it's not worn. Don't use a wet washcloth when you use an electric shaver. That can cause burning. Do not use shaving cream. Make sure that the patient or resident's caregiver knows that we're using that electric razor. Don't use a straight razor on a resident, especially if they're taking any blood thinners such as aspirin. Check the blades to make sure that they're clean and not rusty. So shaving is a daily activity for most men. It promotes physical comfort and psychological well-being. Some things to consider: electric razor provides the greatest safety, but you cannot use it if there's oxygen in use. Use the patient or resident's own equipment and soften the beard and skin prior to shaving, usually with warm water for 1 to 2 minutes, and then pat it dry. Things to consider: use care not to cut or irritate the skin. Shave in the direction of hair growth. Razor bumps are tiny irritated bumps that develop after shaving. People with curly hair are most affected by them. The sharp edge of a closely shaven hair can curl back and grow into the skin, causing irritation, pimples, or abscesses, and even scarring. When we use a razor for surgery, the razor head or blade of the razor are disposable, and the battery handle is disinfected after every use. This is a lot of times used for patients with hairy chest men who need abdominal surgery, cardiac surgery, or anyone going to a cardiac catheterization lab. We would shave their groin. So let's talk about hair care. So hair care includes daily brushing and combing, styling, shampooing. Make sure hair tools are kept clean. And again, this goes back to how often does the resident take care of their hair. Because hairstyle is personal preference, ask them. Make brushing and combing part of morning care. Protect your resident's clothing by placing towels around their shoulders. Cover a pillow with a towel for a resident if they're confined to bed. When you brush someone's hair, you refresh them. It improves their morale, stimulates circulation, and distributes natural oils evenly. It also can remove lint and dust from the hair. Handle hair gently when you brush it or comb it. So you section the hair and work on one area at a time, just like when you go to get your hair done, girls. Note the appearance of the scalp and the hair, and the hairstyle should be appropriate for the age. Residents are encouraged to do as much as they can for themselves. Comb and brushes are cleaned after each use, and they're never shared. The frequency again is individualized. Use the resident shampoo and conditioner and other hair care products if possible, and oftentimes some places actually have beauty shops available for residents. Methods of shampooing: they can be done during the shower, at a sink, using a stretcher, in a bed, and you can also use dry shampoo. Make sure the eyes and ears are protected and the hair is dried as fast as possible. Cold and drafty areas are eliminated. Female residents are assisted to curl or to set their hair. Barbers or beauticians can be contacted by the facility to care for hair of the residents. The care plan must be checked for any special instructions prior to shampooing someone's hair. So traction alopecia damages the follicles. It pulls the hair too tight, and it can happen with ponytails, braids, and cornrows. It can damage your actual hair follicles and cause the hair to break and fall out. Sometimes extensions and hair pieces can also cause traction alopecia. Changing your hairstyle will usually let your hair grow back, and pulling your hair back tightly for a long time can lead to permanent hair loss. So head lice, yuck, they are itchy. In your hair, that's where you'll find them. They like to hide in the neck area of the scalp and behind the ears. That is what they look like. If you have lice, you likely got it from sharing a hat, a brush, or some other item with a person who had lice. Lice are itchy, but scratching can lead to infection, and in severe cases of lice, the hair may actually fall out. Let's talk about makeup. So apply makeup as the resident wishes you to. Don't make them look like clowns though. Make it age appropriate. Do not share makeup with other residents, and be alert for allergic reactions to the makeup. So as we dress, someone encouraged residents to choose their own clothing. Dress daily in their clothing and underwear. Make sure clothes are in good repair. Dress the weak or affected side first. and undress the weak or affected side last. Let me repeat that. Dress the weak or affected side first and undress the weak or affected side last. You need to know that. Make sure clothing is appropriate for weather and environment. Encourage the resident to wear clothing that matches and is clean and neat. Again, dress should be age appropriate and don't put clothing on backwards. Be gentle and patient with residents as you dress them. Provide time for them to do as much as they possibly can for themselves. Now let's talk about bathing. So bathing removes perspiration, dirt, and microorganisms. It stimulates circulation, and it also exercises parts of the body. It refreshes, relaxes, and promotes physical comfort. It removes odors, and it allows for us, the care providers, to evaluate skin condition. So methods of bathing include partial bath, a complete bed bath, a tub bath, and a shower. You will receive instructions from your supervisor regarding methods of bathing and skincare products to use. Provide for privacy. Reduce drafts by closing windows, drapes, and doors. Use good body mechanics. Keep the resident covered for warmth and privacy. Protect the safety of the resident by never leaving them unattended in a bathtub or a shower. Take precautions to prevent slips and falls. And make sure the tub or water temperature in the shower is no higher than 105 degrees. Make sure you know the number. Establish a schedule. Refer to the policy of the agency where you are working for the shower schedule. Never force bathe a resident. If the resident refuses a bath, come back later and see if they've changed their mind. Rinse the skin completely if not using a no-rinse product. Encourage the resident to do as much as possible. Pat, not rub, pat their skin dry and look at the condition of the skin. When you look at that, you want to make sure that you note the color of skin, the lips, the nail beds, and the sclera of the eyes. If you see rashes, you also want to notate the location and the description. Look for dry skin, any bruises or open areas on the skin. You also want to look for any pale or reddened areas, especially over bony parts. These are also called bony prominences. Drainage or bleeding from wounds or orifices, which are openings. Skin temperature, complaints of pain or discomfort. Now let's talk about perineal care. So the first washcloth to wash the front of the perineum, and the second washcloth would be used to rinse the front of the perineum. So the perineum is the genital and anal area. We clean that to prevent infections, prevent odor, and promote comfort. So we need to make sure we remember the rules of medical asepsis and standard precautions are followed. Make sure you clean from the cleanest to the dirtiest area, which is front to back. The urethral area is the cleanest and the anal area is the dirtiest. So this is the perineum is a delicate area that needs special care. Make sure you use warm water, not hot. Wash gently with the first cloth, rinse well with the second cloth, then pat dry. We all like back rubs. So back rubs stimulate circulation, prevent skin breakdown. They're also soothing and refreshing. Use a combination of strokes. Long, smooth strokes are relaxing, and short, circular strokes are stimulating. Use of warmed lotion applied with the palms of your hands also can provide some relaxation. Typically, we rub for 3 to 5 minutes. And this concludes 5.01, How do we care for someone's hygiene and grooming?